Hey everyone, it's Brett. Just doing a overall update here in regards to all the stuff that's up in the air right now, because I know some people are curious. So I just wanted to kind of do that and then just talk about what's going on in the world. Wanted to first of all just really thank and acknowledge each and every one of you. And again, you know who you are, for whatever it is that you're doing, whether it's at your own self-growth all the way up to impacts throughout the world, in whichever way that really is, and you being your most generous and beautiful self in whichever way that you are. And I just want to acknowledge you there. I want to thank everyone also who has been following the Eunoia Health Tech journey to help build 100 tiny homes by July of 2026. And the newsletter called The Nature's Remedy that we launched, I want to say not even 2 months ago, has now over 1,600 subscribers. And that wasn't me, that was you folks that decided that what we were providing through a newsletter, and it's on LinkedIn if you haven't checked it out. We have now, as of today, we want to acknowledge that here too, we have just published our 100th article. Yes, 100 articles on food. And we're just getting started. I want to acknowledge, although we have 100 articles at this time, we're looking to have 365 articles published here, and just on food. And not food just here in the United States, food all throughout the world. Food that's integrated into societies and cultures. And believe it or not, we're looking at it too from an overall natural aspect. Food can be medicine, and medicine can be food. And I think that's another real thing right now that, and speaking from, I guess, the viewpoint of the Empower podcast, again, I'll have a link here or somewhere, so you can go ahead and check that out too, is that's one of the other areas I think that patients are going to discover next. That's what's next, is what's on their trays and the integrity of that. I don't think it will be that overall interaction of the overall patient with the doctor. It's interesting to see, not to say that that isn't important, it is truly important. Matter of fact, if I didn't have relationships with doctors, I wouldn't be here with you talking, sharing, folks. I wouldn't. So it's that overall team aspect I think we have to be able to acknowledge. It was called the interdisciplinary team when I was being educated. And that's everyone. That's social work. That's respiratory therapy. That's physical therapy. That's administration, right? That's also nursing at the bedside. That's also present managers. And that's just getting started. We still have custodial, we have other ancillary staff, we have security. I want to acknowledge all of these people. I haven't had an episode of Empower, I looked, now in over 300 days. And for me, what's next around that is to continue sharing around this. Empower, for those who don't know, was a podcast founded by healthcare professionals, for healthcare professionals, and still is there for that, to be able to allow them to have a voice as to what is truly happening in healthcare. There's over 45 plus episodes of it, if you haven't checked it out. And some of our guests that are there, when I acknowledge them here and now, they gave their voice when they could. And their voice was ahead of their time. And they're not the only one. And I think the systems and people are starting to see that. I think healthcare systems are already also seeing the tenderness of the relationship and the trust between the nurse and the patient, and still allowing them autonomy, a say in the matter. With that, with celebrating 100 articles and talking about what is so, I want to leave you with an empowering quote. And that quote is this: there's somebody, everybody, nobody, and of all of those, they're all expecting someone else to do it. So the question is for you today, are you going to be somebody, nobody, or everybody? Thanks. Bye for now.